is a very important occasion, another great milestone in Continental hospitals, as we have done a very complicated renal transplantation in a patient. I know that hundreds of renal transplants have been done in our state, but we are very proud for this particular patient because the patient was very sick with a lot of other medical problems and he was very young. He was unable to afford his dialysis and he has several monetary problems. So our transplant team, our comprehensive transplant team, evaluated the patient. Our nephrologist, Dr. Kavita, has taken deep interest in working with the patient and the family. So the important thing about transplantation in any hospital is to have an appropriate team. It's not just the availability of the physician or the surgeon, but a transplant team comprises of a counselor, it comprises of a transplant coordinator, it includes a good laboratory facilities, a good blood transfusion center or a blood banking system in the hospital, a good clinician as a nephrologist who properly works up the patient, so that in the country, once we do the transplantation, the patient may have rejection, infections, and complications. So the doctor has to be very active and proactive, making sure that such complications are truly minimized. The surgeons are very important. Transplantation, again, is a teamwork because there is a donor and then there is a recipient. This has to go simultaneously. And most importantly, the ICU setting after the transplantation is extraordinarily important, for which today Continental Hospital leads in the country for having very specialized intensive care units, where we are extraordinarily careful in terms of reducing or almost eliminating infections, as we have proven this last 1 year in hundreds of surgeries that our post-surgical infection rate has been 0. So this is of tremendous advantage to transplant patients, because we understand that transplantation is complex. It involves a lot of money for the patients, and it involves a lot of further medications and care. Hence, if a patient dies from an infection, then all of the effort that has been put in place, sometimes for months or years, goes to waste. So we are proud with our kind of a statistic that we are able to lead the state and lead the country, and look forward to helping hundreds of patients, not only in renal transplantation, but we have an extraordinary team for liver transplantation, and Continental should lead the country in the shortest time, as one of the best transplant centers in the world. With regards to the technologies, first of all, our laboratory diagnostics are very advanced. And number two, we have the most sophisticated blood banking system, and all sorts of blood products are available, because we do not know in a patient like who undergoes complex surgery what kind of blood product requirement will be there as an emergent basis. Number three, availability of good operation theaters, which is very important. Number four, availability of all instruments, which is also very important. And number five is the intensive care setup. Number six, your nursing care and the ancillary support services in terms of technicians, in terms of other people who facilitate the perioperative and the post-operative care of the patient. So these are all the things which are very, very important, and we have very specialized trained nurses and trained staff. And as I already mentioned, we have extraordinary nice intensive care units. So transplantation is not something which can be easily done in any hospital. Yes, surgeons are there to do the transplantation because they have the skill set. Nephrologists are there to make the diagnosis. But the point is that the patient's survivability and surviving immediately after and in the long term, and not succumbing or dying from an infection or developing other complications, is going to be very important. So unless and until you have these facilities and resources, then only you can guarantee a successful outcome in the long run.